Very good. How are we all this morning? Good. We good to go? Okay. Well, good morning, Queensland. Today I can report 11,947 new cases reported. That includes 3,308 that are registered with our rapid antigen test positives. That brings us to 85,112 active cases that are registered, and of course there are other people we know who may very well be showing symptoms but haven't been tested but are isolating themselves at home. I do sadly have to report another 10 deaths in the last 24 hours. The age of those individuals range from their 30s to their 90s, and I just want to again pass on our condolences. This is not easy. Knowing that people are going to lose their lives from this virus, what it does is reinforce the importance of getting vaccinated and getting your booster. And it's great to be here at Stafford at the pharmacy. Of course, they are delivering boosters here, and 5 to 11-year-olds and up. And I believe some people are even lined up today to get their booster, which is fantastic news. And I want to remind everyone that from tomorrow, that if you have had your second vaccination 3 months or longer, you can come forward now and get your booster, and you can go to many of our wonderful community pharmacies right across Queensland, GPs or our public vaccination clinics. I can report that we've got 863 patients with COVID in our hospitals. 47 of those are in ICU, 33 non-ventilated and 14 ventilated. I do want to say that is a slight decline, and we welcome that decline in our public hospitals, but we are starting to move some of our COVID positive patients into the private hospital system, and we will start reporting on the COVID patients in private hospitals in the next few days. We spoke with the private hospital sector on Friday afternoon, who said that they're now seeing patients who are coming in for other reasons, but at some point while they're admitted into the hospital system, they are becoming positive COVID, and it is important we start recognising and reporting on those numbers of positive patients in our private hospital system as well. So we're just working with them to collate that data so we can report on that each day. But it is still a positive sign, but too early for us to say what that actually means as far as a little bit less numbers in our hospitals. Some of those COVID patients, and I know the Chief Health Officer will talk a little bit more about this, the information I've received are they could be COVID positive patients who have recovered from COVID but still have ongoing other conditions and need treatment and still hospitalisation, and they're the ones that are being handpicked to be moved to the private hospital system because the clinicians believe that they can be adequately cared for and that the private hospitals have the facilities to be able to manage those people. Our vaccination rates are now at 91.82% and 89.14 double dose, so we're slowly creeping up to that double dose. Again, I remind everyone who's eligible for their second dose to come forward. We have Moderna and Pfizer available at many of our clinics, our pharmacies and our GPs for people to be able to get their second vaccination. Our boosters are at 65.3%, over 1,179,011 as of yesterday, and more when we add the numbers here today who are getting their booster. 5 to 11-year-olds, we are now almost at 25%, which means almost 1 in 4 of our 5 to 11-year-olds are vaccinated now, 24.62%, 117,846. Thank you to the parents who are bringing their children forward to get vaccinated, and I'll remind parents that it's just as important to get your 12 to 15-year-olds vaccinated as well. We are not at 70% double dose for the 12 to 15-year-olds, so we really want to see those numbers come up before they start the school year. Again, I remind people about the change to the booster eligibility. 3 months from tomorrow, you will be able to come forward. So anyone who had their second jab in October last year or earlier, you are absolutely able to come forward from tomorrow and get your booster. A couple of other things. Well, last thing is the Critical Essential Worker Public Health Directive. So we will be updating this directive to take effect from tomorrow. We've been working with industry and union stakeholders that we were one of the first to release a critical essential worker directive, allowing people who are close contacts in certain circumstances to come back to work where they are deemed to be a critical essential worker. We are changing the parameters of that to bring it into line with the eligibility around testing and the criteria for employers in line with the National Cabinet decision from a week ago and AHPPC. We've just been working through this for the last week. What this means is where you are a critical essential worker who returns to work as a close contact, you are required to undertake a rapid antigen test on day 1 and every second day up to day 6. So day 1, 2, 4 and 6. And it is a requirement of your employer to make that test available, and you cannot commence work until you have that negative test. We are also requiring consent, so employers and employees must agree that that person comes back into the workforce. We know close contacts are also caring for other loved ones in the household, including children who are positive and may not always be able to come back during that period. So we want that to be very consultative between the employer and the employee. And we are widening just slightly the categories of critical essential industries and picking up some of those additional industries that are listed in the National Cabinet document. So we will be bringing in the beverages. We've had the sector talking to us a lot about bottled water, and I know we're actually sending a lot of our bottled water over to Tonga and to help with the recovery over there, so it's important we have adequate supply. So beverages will be added, and also, as the Premier previously announced after the National Cabinet decision, telecommunications, broadcasting and journalism will be added, and that will apply from tomorrow as well. Also, we are clarifying health. So health will include aged care, so the private aged care sector as well as the public, and also the disability sector. Now, we're not talking about the volunteers, we're talking about paid workers, support workers and disability workers. We know that they have a really critical job, especially when they're caring for vulnerable people with very significant disabilities in their homes. This worker may be the only person that they see. Without them coming and helping with their care, then they will not get that care. So it is really important, but we need to balance their safety and make sure that those very, very vulnerable people in their homes are not put at risk by taking the virus into that home. So that's why they'll need to undertake this more frequent testing. I also want to say it is the government's view that best practice is that where you are a close contact and a critical essential worker, and we are allowing you to come back into the workplace and you're consenting to come back into the workplace, that where employers can, they should be testing daily because that is best practice. That's where we would like to move to once there is more readily available rapid antigen tests for industry. At the moment, we will align with the National Cabinet and AHPPC, but we would like to see that daily testing. I know there's many industries that are already doing this and have been doing this for weeks and months, such as the mining, the abattoirs. Some of the distribution centres have been doing this daily testing anyway because they know it is in their best interest to not allow the virus to come in and infect other workers in that workplace, because they could end up with the whole workplace in isolation because they're positive. So, with the ability to be able to bring these workers back into the workplace comes responsibility, and that is to do everything possible to minimise the risk that that person is positive and bringing it back into the workplace and spreading it so those people are taking it back into their households and in the community. I'll now hand over to the Chief Health Officer, and then we'll hear from Jimmy Sullivan, who's the local member here for Stafford and whose electorate this wonderful pharmacy sits in at the moment. Thank you. Dr. Drudd.
So thank you very much, Minister. So sadly, we have 10 deaths to report today. One person in their 30s, one in their 60s, 7 in their 80s, and 1 in their 90s. 3 were unvaccinated, including the 2 youngest of this group. 7 had received 2 doses, and none had received boosters. Our thoughts are very much with their family and friends. In terms of hospitalisations, we have a total of 863 being treated in Queensland public hospitals as of last night, and that was down from 884 in the previous 24-hour reporting period. As we all know, we shouldn't make too much of a single reading. We really need to look for a trend, so I wouldn't over-interpret that. There are a number of reasons why that number could have dropped, including changes in discharge practices on the weekends, possibly also because of some transfers of stable patients to private hospitals. But obviously, you know, it's down is better than up, so that's good. But again, I wouldn't over-interpret. And in the intensive care units, the numbers were down as well, slightly. So there were 47 patients in intensive care in the last 24-hour period, compared with 52 on the preceding 24-hour period. So again, a small decline. That's positive, but let's not over-interpret a single reporting period of 24 hours. Thank you very much.
Thanks, Minister. It's great to have the Health Minister, the Chief Health Officer, and of course the Pharmacy Guild here in Stafford. We are really proud in our community of our health workforce, including, of course, the Prince Charles Hospital, which is an icon of our community. But we're also really proud and thankful of the hard work that our community pharmacies do as a broader part of the health fabric. Right now they're doing boosters for those eligible after their 3 months. They're also doing vaccinations for children right here on Stafford Road, but other community pharmacists right across our community. We thank them for what they do, and I encourage everybody who's eligible. Right here we've had a huge demand from local families for trying to get their kids vaccinated before school. I thank them for coming forward, and hopefully we'll all be safer for it. But get down to your local pharmacist. Jump online, you can get vaccinations appointments that way, and again, if you're eligible for your booster, come on down to your local pharmacy. They do a great job. Thanks.
Thank you, Minister Dr Gerard, and for the member for Stafford. I appreciate the opportunity to address you all today. My name is Chris Owen. I am the President of the Pharmacy Guild of Australia, Queensland branch. Community pharmacy is the most accessible primary healthcare destination, with over 1,200 stores across the length and breadth of the state. More than 90% of Queenslanders live within 2.5 kilometres of a community pharmacy. Community pharmacy has delivered over 800,000 vaccinations to Queenslanders since starting the program in June 2021. Nationwide, we're delivering nearly 100,000 vaccinations every single day. We'd like to congratulate the state and federal government for ensuring all frontline workers are involved in the rollout of the vaccines. In rural communities, especially, the pharmacy is the first port of call for those patients who have lower access to health needs. This includes primary course, boosters, and of course the rollout to the 5 to 11 years age group. With the change in booster interval from 4 months to 3 months, there are now hundreds of thousands of more Queenslanders eligible for their booster shot. These are available through community pharmacies, state health clinics and general practice. To find an available appointment at a pharmacy close to you, please search and book for your appointment at www.findapharmacy.com.au. Walk-in appointments may also be available, but will be dependent on daily availability at each site. Please be flexible with your booking arrangements, as this is an extremely busy time and it will only get busier at this time through stores. Most importantly, please be kind and respectful to your primary healthcare workers and vaccinators. It's an extremely stressful time for all in the community, and a few words of encouragement can go a long way. Thank you to all community pharmacists and pharmacy assistants, and indeed all healthcare practitioners, for your dedication, skill, time and patience throughout the pandemic. I'll briefly move on to rapid antigen tests. The supply chain is working overtime to provide these tests for Queenslanders. There are tens of millions of tests on their way to Queenslanders across the state. Pharmacies are currently experiencing a huge number of inquiries and phone calls, And we would ask for those who are seeking the rapid antigen tests to please check social media channels first. So please look at Facebook pages as opposed to ringing the pharmacies themselves. Again, Queenslanders have been patient when searching for these rapid antigen tests. We thank you for that, and we hope that it keeps like that. We're all trying our level best to try and provide these tests as soon as possible under difficult conditions for supply and staffing. Lastly, I'd just like to touch on the COVID-19 Rapid Test Concession Access Program, which starts tomorrow, the 24th of January. This program will allow all Commonwealth concession card holders to receive 5 tests for free per month, up to a maximum of 10 tests across 3 months. So that is 10 tests until the end of April. These will only be available through community pharmacy. Although this program does start tomorrow, most pharmacies are still waiting for stock and waiting for their orders to arrive. So they will not have stock available for this program tomorrow. I repeat, most pharmacies will not have stock available for this program tomorrow. Please check findapharmacy.com.au to search for your local pharmacy, where they will indicate if they have stock available. As more stock becomes available, they will update this website, so please check this website before going into a pharmacy. As stock availability improves, we will hope to see more Queenslanders having these tests. We understand it is difficult through not only workplaces but family environments, religious centres, sporting environments. We do take into board that it is a very critical time in our state, but we've done very well up until this point, and we hope that continues. Thank you for your time.
Chris, before you go, can I just ask, so when you do get the next supply of stock coming in, how would you handle the distribution of that per RADs? For example, will you be putting a section aside for those concession card holders, or how will it work?
So it's a moot point at the moment. Obviously, there is no stock available. They're rare as hen's teeth, as they say. When that stock does become available, I would expect that pharmacies would have equitable access. So whether it's the same pool, but we would expect our members, and all pharmacies for that matter, to provide equitable access to both that concession environment and the private market.
And can you give me an idea of, like, at the moment, how many phone calls are you taking? When you do get the stock in, how quickly do they go? What sort of pressure is it putting on your staff here?
Well, anecdotally, as I said, I haven't had a stock delivery since the 28th of January in my pharmacy. So anecdotally, I'm receiving 200 to 300 phone calls a day, which is taking us away from business as usual. Our core business is dispensing prescriptions and providing advice to Queenslanders. By answering that phone, we are taking that time away from other patients. So it is something that when pharmacies have got stock in, and I've heard from my colleagues that it's within hours that those are going. But again, it is something that as the supply improves, and we expect that supply to improve over the coming fortnight, that there will be plenty available for everyone.
And you said 26th of January, do you mean December, sorry? You haven't had
28th of December, sorry, yes.
So you haven't had RAP coming since the 28th of December?
Correct, in my pharmacy, yes.
So are people irate? Are they panicking? Are they upset? How would you describe their reaction?
Like anyone would be in this situation, is that they're scared, I think, is the primary motivation. We're dealing with this disease outbreak that Queenslanders have never dealt with before. We're trying to take our level best in social distancing. We're trying to get as many people vaccinated and boosted as possible. But we also need to take care of those around us, and by doing that, we are taking those precautions, and rapid antigen tests are one of those precautions. So I think ultimately it is a function of trying to protect ourselves and our families. So that's manifesting as being scared. I don't think people are genuinely being argumentative or angry in any purposeful way. I think they're just frustrated at the situation that it is. And we're all trying our level best, but unfortunately there's factors that no one could have foreseen that's led to the situation.
And you said the tens of millions of rats on the way. Do you mean in the next fortnight there?
I wouldn't put a time frame on it. That's the amount of orders that I know that are coming into Queensland. Whether the stage of those orders are at, so they might be within the distributor, they might be the manufacturer, they might be in the transport links. But there are those tests that have been ordered, some paid for, that should be on their way. As I said, whether it's within the next fortnight, I can't tell you with a surety, but I would hope to see that the situation improves ongoing, and then by sometime in February, I would hope earlier, that it would be resolved.
Dr. Gerard, we are not reading much of today's hospitalisation figure, but can you provide an insight on when we might see hospitalisations peak and the overworked Queensland Health staff see some improvement?
Yeah, it's a very good question. It's the thing that it's the issue we're all hanging out for. In reality, we're not going to be able to tell when the peak has passed, when we reach the peak, until it has passed. So the real proof will be when the numbers of patients start to fall. And so that will be a number of days after the actual true peak of transmission and true peak of admission to hospital. We know in Queensland it's not going to be uniform either. Gold Coast clearly has the largest number of patients. I think this morning they had 9 wards across the public and private sector with COVID patients on the Gold Coast as of this morning. And we're expecting that to peak in the next few days. Now, when will we actually see the number of inpatients fall? I'm hoping we will start to see it sometime in the coming week, but that's hope, and that's what the modelling suggests, probably starting with the Gold Coast, and that's what we're watching every day. Admission rates do tend to get a bit disturbed by weekends and public holidays, and we've got a public holiday coming up, so that may scramble things a little bit. Doctors tend to discharge more patients on Fridays and Mondays, so that's why we don't like to look at one single day. But I mean, it's good that the numbers aren't increasing. This number of 863. That's substantially lower than our projections for the total number of inpatients we're expecting. So I think there's a lot more to come. I think there's a lot more to come, particularly around the rest of Queensland.
And how many consecutive days of falls?
We'll see when we get there. I mean, I'm thinking 2, 3, 4 days. That's the sort of number we should be looking for.
But this man in his 30s who passed away, did he have underlying conditions, and did he die in hospital or not?
The person. I have no further details about him. No, I have no further details, and I really don't want to pin down on the specifics of the cases. I believe they had underlying conditions, but
Were they vaccinated, do you know?
they were not vaccinated. No.
They were not vaccinated.
No.
And you were talking about the patients being moved out to the private
Yep.
sector. I know the health minister said you don't know how many COVID patients are in the private sector, but
Yep.
can you give us an idea of how many patients are being moved into those private hospitals?
Okay, so some of the private hospitals have emergency departments, and I understand that they're taking. They have quite a number of private hospitals, I think, have designated COVID wards now. I can only speak for the Gold Coast because I spoke to them yesterday, and they had transferred a small number of hand-picked stable patients from across the wards between medical teams that knew the patients anyway. And we're talking like there were half a dozen, that sort of number. I can't give you a precise number. What we will hopefully be doing is trying to collate the number of patients that are in the private hospitals this coming week. So you'll be able to that'll be clarified exactly how many people are in private hospitals as well with COVID.
And on the hospitals, how many private facilities have you got on standby or utilising at this point in time to help with the numbers of patients?
I think the Minister may have a better idea of I don't know, Minister, if you have it, maybe has a better idea of the number of beds we have in the private sector allocated. It's done by bed numbers rather than hospitals. It's across the state, and I'm sorry, I don't have the specific numbers here.
So you'll be trying to differentiate the numbers. You'll be giving out the numbers of those in hospital for COVID and those in hospital who acquire COVID.
No, we just report patients in hospital with COVID. It's become very difficult to distinguish those who happen to be in hospital with COVID versus because of COVID. It's a bit like the deaths. We're just reporting pretty well, unless it's very clear, very, very clear, that someone has died from a completely unrelated cause. I know we had a young person who died in a motor vehicle accident, for example, about a week or two ago, who just happened to swab positive in the post-mortem and the forensic sciences laboratory, and clearly it wasn't the COVID, wasn't the cause. So it is becoming increasing, with COVID being so widespread, it is becoming increasingly difficult to distinguish who is in hospital because of COVID and who is not.
Just this might be something you don't have to hand, but can you give us an idea of the demographic of what, of the people that you are seeing in hospital? Are they people in their 20s, 30s, 40s, more elderly people?
It depends on the vaccination status. So they're two completely different groups. Generally speaking, I mentioned yesterday that the triple dosed patients are about 20 years older than the unvaccinated. So the unvaccinated around average age of around 39, 40, but there's a big scatter. And the average age of those that are particularly triple boosted is older than that, around 60 or thereabouts, and with a range around that. And double boosted is slightly younger. So sorry, just to be clear, that clearly shows how effective the vaccination is. Sorry, go ahead.
Now that we're counting patients in private hospitals too, does that mean we can expect a bit of a spike?
Yeah, when we do report that, we'll make that clear that there is a spike, and we may well report them separately. We just have to work out how we're going to report that.
Can I ask the health minister's question?
Sure.
Today, New South Wales has announced that the students, they'll be providing tests to students on a daily basis. Victoria is also strongly recommending that students have RATs twice a week and that they're going to provide them to schools. That's New South Wales is also going to provide them to students. Will Queensland do the same?
So I haven't heard the detail of New South Wales. I was just getting in my car as that press conference was happening this morning, but the Premier's already addressed this after National Cabinet this week, that there isn't a decision of National Cabinet to do this. There is not advice or recommendation from AHPPC or the Chief Health Officer that we need to do this level of testing in young people. It's not a comfortable test at the best of times, and we just don't believe that at this stage we need to be testing children in that way and that regular, knowing also that there is a shortage of supply of these tests as well. We believe that those tests are best focused in the areas where we need them the most, such as industry being able to get hold of them for critical essential workers, aged care, health being able to get hold of them for our necessary purposes of testing patients and our staff as well. So that really should be the priority. And of course, as Chris has just said from the Pharmacy Guild, and I want to acknowledge the Pharmacy Guild and all the pharmacists and their staff and the great work they're doing, as well as our GPs and their staff, that there is real challenges right now. It's been announced that concession card holders are going to be eligible to get these free tests, and they're actually not available right now. That worries me, because I think our pharmacies will see a lot of people coming forward this week expecting that they're going to be available. And I just want to echo the words of Chris that please show respect, have a look online first. Don't take a journey to the pharmacy if you don't know if the pharmacy's actually got that stock in. And if you can check online without having to call the pharmacies, that will really help them as far as the pressure they're on and the demands on their time as well. But it is a real challenge. So no, there's no change for us when it comes to school and testing students at this stage.
Minister, at any point will you consider allowing close contacts in industries like tourism, hospitality to go to work?
Look, at this stage, that is not the advice that we should move to that area. Look, all businesses, I think every single business in Queensland is impacted by staff who are positive or who are quarantining because they're close contacts. So it's having an impact across the whole economy and most of the country. And so, if we move to the point that there's so many on that list that there's basically no one outside of it, you're moving to a strategy of all close contacts can go to work. We are not there yet. We're moving into the wave. We haven't hit our peak, and even when we do hit our peak over the next few days in the Gold Coast, I want to remind Queenslanders that this peak will move around the state after that. So it's not like we're going to get this quick peak and then in 2 or 4 weeks' time it's all going to be over and we can get back to our normal lives in Queensland. It will peak in the Gold Coast, it'll then move into the border southeast Queensland, it'll move into areas like Cairns and our big tourism areas, and it'll move into our regions. And I still have concerns in those particularly remote communities that still have low vaccination rates. I really do fear about this going into their communities and having large numbers of cases when they're still not vaccinated, and I want these communities to come forward and get vaccinated as quickly as possible.
On those remote communities, we know that one of the biggest issues in those communities is overcrowding in housing. How can you socially distance, or how can you keep yourself safe when you've got 15, 20 people living in a house? And, second part of that question, what can the government do to provide some more facilities that people are able to spread out in the community if there are positive cases?
Look, we're working with the communities. We've been working with the mayors for 2 years, about how we manage COVID in the remote communities. This is why many of the ministers, including myself and the Premier, went out into these communities over the last few months, just begging them to come forward and get vaccinated, because we do know that large number of people live in these households. I was advised just from one of our chief executives in North Queensland the other day that one of these communities, there's still the anti-vax sentiment. They don't believe COVID's real, but they actually have COVID. So we've got people in those communities who are not vaccinated, who don't believe COVID real and is positive for COVID, and are refusing health care. And they're in a household with lots of people. We can't force people to social distance in their own homes. We know this is complex, we know this is difficult, and that's why we'll do everything to support those communities in getting their vaccination rate. I know there's been talk about rapid antigen tests and regular testing in these communities, also locking down these communities, but locking down the community when you have widespread circulation of the virus is a very short-term measure which will not see a reduction in the number of people that will eventually get this virus in these communities. The most important thing is the vaccine.
Could you provide things like, and I'm not saying this is a solution, but for example, like dongers or something like that,
Well, look, as far as I'm aware, those calls haven't been made by mayors asking for those sorts of arrangements, and even if we were to offer them up, there's no indication that people will move away from their families. You've got to think, if they don't believe COVID's real, if they don't support vaccinations, why are they going to isolate themselves from their family? They don't think it's a problem. So that's a concern, and that's why we're working with a lot of our RHAs and our First Nations communities and our NGOs out there, who I know are doing an incredible job to try to get that vaccination rate up.
Just quickly on another matter, the Triple C, when will that be discussed? The Triple C report in Cabinet, and what's the future of that one looks like?
Look, the Premier has said this a number of times. This report will be considered by Cabinet. Every single Cabinet Minister will fully consider this report to be able to have input into that consideration. It's up to the Premier when that report comes before Cabinet. But we will all be fully abreast of this report at the time that we are required to consider it.
Could it be as early as this week? When does Cabinet resume?
Cabinet resumes this week. That's for the Premier to talk about. I'm not going to comment on Cabinet confidentiality and what's on Cabinet agenda.
And Minister, Pauline Hanson's called for a royal commission into the management of the pandemic by state and territory leaders and the Commonwealth too. Given the level of government intervention over the past 2 years, is that an appropriate call?
Well, maybe they should have a royal commission into the number of elected members who have anti-vax sentiment and what damage that's done in people coming out and getting vaccinated and believing these false truths out there about the safety of vaccine, about whether COVID's real and where it's come from and all of that. I'm just appalled about that whole debate, and that we've got particularly elected representatives in the House of Representatives and the Senate who have done so much damage in this country to the perception of vaccine and COVID. They have a lot to answer for, and can I say personally, Scott Morrison's so-called admonishment of George Christensen the other day was an absolute joke. Just to ask him to stop. George Christensen's been doing this for months and months and months. So has Senator Rennick and others. They've got assistant ministers, they've got ministers who have undermined mandatory vaccination. They've had town hall meetings, calling it segregation. I think it's irresponsible and disgusting, and the Morrison government's going to have to take responsibility. So if they want to do an inquiry into that, happy to contribute.
Tennis Australia said it's disappointed that the Brisbane International has been cancelled 2 years in a row. Would you ever consider financial help or helping it to get back on its feet for next year?
I think what we can do to try to get all of these events happening, I'm really hoping that we have a lot more events happening in 2022 and beyond, is get through this and manage this virus as best we can. We have really led the world in the way that we've managed this virus. The fact that we were able to suppress it for 2 years to get people to 80% and beyond fully vaccinated is extraordinary. It has put us in a very good position as far as our hospitalisation and ICU rates. Sadly, there is still loss of life, but we are trying to limit that as much as we possibly can through our vaccinations. And remember, the vaccination journey is not over, so as long as people are still getting vaccinated, getting their boosters, getting our kids vaccinated, this will help us get through this and be able to open up as an economy and start living with the virus into the future. But we're not there yet. We've got to get through this big wave and we've got to manage this as best we can. Thanks, everyone.
Thank you.
Do you want to, I'd like to say